Um, Many of times it has been like a year or two, I haven't gone to where they sell Casper. Why? Because I have it within my mobile phone. All that I need to do is to get into my mobile banking app. If I want to let's say buy Casper, I'll just go there, buy Casper. If I want to buy credit, I can buy credit. If I go to some mini markets or restaurants sometimes, I can use that similar platform to do my payment on whatsoever without having to carry physical cash across. And then recently we had the kind of the advancement in terms of mobile money. Who knows what AfriMoney is? AfriMoney. How many of you are using AfriMoney here? How many of you are using Key Money? How many of you are using Wave? How many of you are using Wave? And how many of you are using Table Pay? What of Casma? So all these are platforms developed specifically by Gambians or managed by Gambians to help us to reach that financial inclusion. Gone were the days where you would carry hundreds of thousands of dollars, putting it inside your bag and then moving along the street. But now you don't have to do that. And gone were the days too when you would have to call, for example, your parents as far as in the provinces and ask them to come down to come and receive money from you. Isn't that challenging? Isn't that time constraining? But through Wave, through Table Pay, or through AfriMoney and Q Money today, you just have to go to their branches, do your deposit, and then send those people the money, and they will just go to their sub branches and collect the money. Isn't that something thriving and innovative? Isn't it? Awesome. So, in addition to that too, we also have something very interesting that have been developed by someone seated here within our midst called Bitik, actually powered by Mr. Omar Jase. So it's more or less like kind of an accounting software that help, let's say, shopkeepers and those with mini markets or even restaurants per se to be able to keep track of their finances and their inventory. So through this platform, they're able to know exactly how much inventory they have at any given time, how much products, how much profit they have sold within a week, a day, per se, a week, month, or even within the year. And at the same time, continue to update to know exactly what kind of, let's say, losses or profit that they have made during a particular period of time. And I think this is something that also serves as an innovation and a testament that we have Gambians that can do it. We have Gambians that have been inspiring. We have Gambians that have contributed meaningfully in shaping our tech ecosystem. And then definitely what we can do as young people, looking forward to them as role models, is to kind of be dedicated, being persistent as well, and ensure that we acquire as much as skills to become people of excellence, like Mr. Barry said. And the other sector that we will also look at would be health. A clear example would be Nestelt, developed by Lamin Jafune, and then the Innovax, which is also an American Gambian-based company founded by Dr. Ismail Badjie, who's also a Gambian. So through their company, they're able to provide remote, a platform called what we normally call telemedicine. So through that, you're able to have remote consultation with your doctor. So you can be at this school, you can be at your house or within your village or office and have a remote consultation with your doctor to know exactly what you're going through, what are some of the challenges that you're facing in terms of your health, and then provide recommendations as to, or provide kind of a diagnosis on what you need to do and what kind of medicine that you need to kind of take. Instead of having to wake up early in the morning, as early as 6 or 5 a.m. to go to the hospital and then from the morning, be there from the morning all the way to the evening. And sometimes you even find it difficult to get the right attendant. Isn't that something challenging? And this is the beauty of technology, and this is exactly what it is helping us to address. And then we also have what we call electronic health management system through hospitals. So in most hospitals, especially public hospitals, when you go there, what do? They will use a piece of paper, take your name, take your data, your biodata, and then kind of try to diagnose here and there, and then they will write it. And let's say, for example, if you happen to be admitted, every day they will come in, conducting tests, and all this information will be written on a piece of paper, and they will just go and store it somewhere. So let's say if you come the following year, or the next let's say 2 years, for example, and then you visited the same hospital, do you think they will find it easy to go and get that data that data they collected on your behalf when you were admitted at the hospital? It's going to be challenging, right? But through e-health or mobile health management systems, they're able to keep track of all these data, and each and every, let's say, patient is given a unique number. So when you come next 2 years, 3 years, or even 5 years, you just have to enter that unique number, and they're able to get track of all your, let's say, for example, your history, your visits, the consultations that you have, and the different doctors that attended to you. And I think this is something that it has really been innovative as well. And for MRC as well, especially for, let's say, pregnant women, they normally receive what we call, let's say, SMS notification, because they're supposed to visit the hospitals at every given time. So through this process, they're able to know exactly what time they're supposed to visit the hospital, on what days, and so on and so forth. And we also have, who doesn't love food here? Who doesn't love food here? Who doesn't love food here? So good. So we have also another platform called One Banner, and then in addition to that, too, another platform called Chopsa that gives you the opportunity to to order your food regardless of wherever you are, whether in your office, at the school here, whether you're in the playing field and then you feel hungry, or even somewhere as remote as possible, to be able to kind of order your food from whatever desired restaurant that favors you or that you're interested in, and they will get it delivered to you. And last but not the least, we will look at the tourism sector, where we have one innovative young lady called Ramatullah Jallo, who developed a platform called Smiling Coast Africa. And through her platform, you will be able to book different apartments, especially for those that are coming from abroad and coming to the Gambia and finding it difficult to get a place where they're going to live. So these are just examples among many that young people in the Gambia have really been working on. But at the heart of all this, digital inclusion is really something that is needed, and it cut across, starting from each and every one of you, having the skills, having the knowledge and the capacity to be able to use the platform, but again, by extension, having the right broadband and the right infrastructures, especially when it comes to electricity. Since in the morning we have been battling with NAWIC, light will just come on and go off, come on and go out, and that has really been challenging. And for you, the students, to be able to participate meaningfully in this tech ecosystem, you need internet, you need to do a lot of research, and that cannot happen without a stable internet and a stable, let's say, IT infrastructure. So just to conclude, I would like to commend each and every one of you for your patience, for your time, for listening to me, as well as each and every speaker that is seated over there on the high table, as well as those that are actually behind. I think this is just the beginning, and we have a lot to do as a country, and together we can bridge the digital divide and then build Gambia to become a tech hub and, and an innovation center across Africa. Thank you.